Well, first of all, I think it's important to make physicians and other practitioners aware of what data now exists, because in many cases there's a lot of evidence out there, but it's in places that conventional doctors don't look or don't know to look. Secondly, there is often not a very adequate evidence base for many of the procedures done in conventional medicine. And I think that's more of a problem because those methods tend to be more powerful and more potentially dangerous. Another principle that I teach, as you know, is that we should use a sliding scale of evidence that works like this. The greater the potential of a treatment to cause harm, the stricter the standards it should be held to for efficacy. So if I'm recommending a treatment of very low risk, say a breathing technique, I'm quite comfortable recommending that to people in the absence of definitive evidence for efficacy, while encouraging people to go collect the evidence. That's the way I would answer that.
But I have been surprised by the depth of the clinical and the epidemiological research that's going on in the world now. A good deal of it in Europe, but a lot of it here in the United States. I mean, it is surprising. There is a lot of ferment, a lot of research.
Definitely, and in integrative medicine, we certainly want to be consistent with scientific information. And in our own clinic at the University of Arizona, when our doctors in training prepare treatment plans for patients, we always ask them to go through the literature and provide supporting evidence for any treatment recommendations that they make.
I want to talk a little bit about consumer pull-through. One of the things that is going to help integrative medicine, you've often said, is the fact that people are simply demanding it. Is that the case?
I think this has been a consumer-driven movement since the end of the 1960s, and that's an overwhelming pull. I think medical institutions have been reluctantly following that. But now I think the dynamics are changing. I think from here on it's going to be really bottom line financial considerations that drive things forward, because as the healthcare crisis deepens, I think the wisdom of integrative medicine will become more apparent in that, both through its emphasis on prevention and also because it can bring lower cost treatments into the mainstream.